Good afternoon. Are you willing to do some experiments with me? Very important post-lunch, right? So you'll have to really shout loud, whoever is at the back, okay? And you've spent half a day immersing yourself in this beautiful field, okay? So what were some of the words that are staying with you? Words that are staying with you. Optometry. 100 marks. What about optometry is staying with you? Use this a little bit now. So what words are staying for you? Practice, okay. Standards. Patience. Care, okay. I was hoping somebody would pick that up. What lines? Guidelines. Specialities. Social media. Did anybody pick up competence? Did anybody pick up capability? Okay. Vision fields? Missing fields? Okay. So now I'm actually going to take you a little bit different from what you've spent from the morning. Okay. You've immersed yourself into optometry. You've started looking at maybe, okay, for whatever reason you've got into optometry, now how do you make it the best decision for you? Okay. How do you make it successful? Okay. So at the risk of putting you all to sleep, I'm going to try and do one small activity. Okay. So I know a lot of you did a very good job of climbing 4 stairs, right? How many of you are feeling tired out of that? So this is for you, okay? So take a minute and just close your eyes, because I think the whole day you've seen lights and lots of visual stimuli. So just close your eyes for a minute and gently settle down. Start moving from the staircase. Start moving from the food. Start moving from the giggling next to you. Start moving away from the mind. Okay? Because you're going to go into a very, very important aspect of patient care, which is actually the patient. Of course, we've been speaking about the patient from the morning. But today, right now, the next 20 minutes with me is with the heart. So gently, just, you can see the whole room is quietening down. And just connect with your heart, because that is where a connection happens. Now you have 2 fantastic, competent optometrists. A patient goes to them. And they walk away from that experience, likely that the relationship they have will make them come back to them. So just visualize for a minute what kind of experience you want to give to your patient who walks in. Some of you, you're already in your practice. For some of you, you're probably interning, seeing people. Okay? So keep a future situation. You're an optometrist. Person is coming across. And observe what you do to connect to that person. Are you busy in your head, wondering what test to do, how to write? Or are you with the patient? Do we actually see them? Or are we framing our next sentence? Am I wondering, is my diagnosis correct? Or am I actually listening to what the patient is telling or not telling? The minute the patient comes by Googling something and coming, you say, "Arey, I am the doctor here, or I am the person here." But if you look beyond that, you'll find the curiosity of the patient, the concern of the patient, the anxiety of the patient. If the mind doesn't get convinced, then where does the heart come, right? So just thank the patient, because they're teaching you a very important life skill. Because when we want to connect to somebody, we can't just connect for the 2 minutes when we have, an optometrist. We can only connect when we connect in life. So just thank the future patients, because they make us a better human being. And they teach us a very important life skill, which is about patient bonding, care, and connect. So with that, gently open your eyes and just raise your hand when you fully and completely with me here. All right. So experiment 1 over. All right, I'll give you the next experiment. Are you ready? All right. So quickly, stand up. See, I made you calm down. Now I have to get the Josh up, right? So, all right, everybody stand up. And this is an activity. I'm going to count from 1 to 10. We've been doing this in almost every city, so please play with us. This is about connecting quickly with as many people as you can. Okay? So the trick is, or the game is, you're going to greet as many people, front, back, left, right, wherever. Okay? And you're going to greet them in a way that you normally don't greet. So how do you normally greet? She says hi. Okay. So how will you differently do it this time, Nisha? Bye. Hello, remember this is patient bonding and caring, not saying bye. I know. We'll come to So remember this is only temporary bonding. Okay, don't look at any permanent bonding here. I am not responsible. Okay. So here's the thing. So you're gonna greet. Why am I saying this? Is a change in behavior. So are you ready? So as many people, and don't do it mechanically. Okay? Don't do it mechanically. Don't stare at them, but look at them. Okay? Only permission during this session. All right. So with that, as many people as you can, 10 counts start right now. 10, 9, look around, greet each other. 8, 7, 6, 5, 4, Ola, Uber, everything happening. Namaste. What's up? 5, 4, 3, 2, 1.5, 1, 9, 8, 7, 6, 5, 4, 3, 2, 1, and thank you. Please sit down. Okay, every time you see my hand up, it's time to look back here and focus and settle down. Awesome. Okay. So, did you see a shift in the energy in the room? Okay, what was the shift in the energy? Energy. High energy, okay. What else? Happiness. Positive, excitement. Anybody from the back? Concentration, yeah. Enthusiasm. Okay. Choosing life partners. Okay. No, he's very clear it's not. It's just an exercise. See, he's very reality oriented. Thank you. All right, okay, settle. Settle and allow me to do something with this experiment, okay? So, back onto me and settle down. Yeah. The thing in communication classes, whenever we have learned not to speak when somebody else speaks. So, we'll wait till they settle. So, all of you just look back and just settle them down. All right, settle down. Thank you. We'll go on, okay? The next 15 minutes, non-verbal communication, okay? All right, everybody, please give me your attention because what we're talking about is you, not me, okay? So we're going to talk about the basic life skill, which is communicating and winning trust. So when you have competence, you gain one favor. When you do your job very well, you gain a favor. And then you make them feel bonded and trusted that they can come to you and they can share, then you've won that connection. Okay? So in 20 minutes, I really can't tell you how to communicate exactly, but I can leave you with some things, okay? So it's about compassion and care. Now, I'll ask you an honest question, okay? How many of you actually, right now I tell you, hold care in your heart? Can you hold? Honestly, not many of us, right? We can think about care. I can know how to show care, but I feel care running around me, not really all the time. Because we're designed to be mental beings. It doesn't mean, immediately we will fall for the patient in terms of, not fall, but fall on whatever the patient feels, make them feel happy, nice. That's not the point. You'll do a diagnosis, you'll do a fantastic job as an optometrist, but there is a bonding and a care. So that's where the foundation of this, because if this comes, then every other thing you do will have that. And that cannot be taught, that can only be experienced. Okay. So why do we communicate with care? Essentially, it allows a personal touch. No two doubts about it. You take any field, that personal connection is needed, particularly in healthcare. Second, it doesn't make us mechanical. Like, let's say we have so many patients coming in and out, okay? We are also tired maybe, or we are frustrated, or we fought somewhere else and we came back, right? And we end up doing just a very mechanical job. And it's not just for youngsters. Anybody and everybody is prone to this. The joke I say is, yesterday I brushed my teeth, so today, it's okay, I don't need to brush my teeth. I can't say that. So like that, yesterday, fantastic, I listened. Today, I can't listen, it's okay. I can't do that. The patient will be wondering and confused. I came last time, he was very warm. Now I'm coming very cold. कैसे हो सकता है? So, sometimes why it is important, the bonding, is when you want to share news that is tough or news that is not comfortable. And lastly, also, there are some unspoken expectations from anybody to us as healthcare, which is, I want to come, I want to get healed, okay? So help me. That's an unspoken expectation. Body and mind is connected. A lot of these people will have doubts. And that has to be communicated and worked with. Like if you remember what Isha talked about, the E part of SOAP, right? Which is like educating them. It's not just the facts, but making them comfortable. I mean, I've had so many people who say, it may sound very frivolous saying, hey, my look will change if I wear spectacles. But that person's reality is that. We can't sit in judgment and say, look, it's only a spectacles. We can't do that. But instead, we make them comfortable saying, yeah, it will be odd. Friends will make fun, agreed. But look at the bright side and give them a little alternative. Okay? And then it builds trust, of course. So I covered most of this. The only thing I'll probably say is that it gives you a standard of who you are as a practitioner. If you maintain a good relationship, and not just with patients, as in life, in your relationships, in the co-management with other optoms, you never know where, or with ophthalmologists, vendors, anybody, this skill is very, very important. So what do? We look at our nature of interaction. The exercise I asked you, the first experiment was that, which is, do we even think what kind of experience we want the patient to have when they walk away, even if it's not good news. Putting them at ease, managing expectations, our attitude and orientation, which is the prime of the time that I have with you today, and a safe and trusting space. There are some people whom we come across them, we automatically feel like talking to them. There are some people we just feel like nothing, we don't say much. So the thing with us is we need to build the skill and the quality. Can't just be a skill. Some things that do not help us is, in general, we don't connect. The standard escape route, escape is not in a bad way, but escape route is like, I'm an introvert. I said, that's okay, but introverts also connect. Every introvert in the room will say, of course I have connections. So the trick is to make it true and live for them, to become comfortable with that. Language, as people previously said, no time. Many people give this excuse. Do I work on the diagnosis or do I work on the patient? It's both. Okay? Unable to express, and your own personal burnout. So if you don't eat well, if you don't sleep well, the next morning you are much more irritated and prone to small triggers. Okay. I don't need to tell that. Life experience tells us that. So what do? Mindfully express and very compassionately listen. So what I want to leave you with is this thing, which is manage yourself, manage your communication. And this is a choice in the moment. Okay? Third experiment for now. How many of you are right now in the moment here? So if you can do it, right? Exactly. So what do? We hold care and compassion in our attitude. Okay? And look at the last line here. To do right by the patient. And compassion is not just empathy. Oh, you feel something, I also feel that. Not that way. But compassion is like I move to do something. Whether it's referring, whether it's the right diagnosis, whether it's asking questions, whether it's following the full protocol of checklist, whether it's a full protocol of history. You name it, if you do that, that is compassion. The next one is your inner space, the question that I talked about, the care. So which means in general, hold care in your being. It'll change your life otherwise also. So try this experiment and say that, do I generally have care? It can come in our words, it can come in our actions, it can come in the way we smile at a person. Genuinely take that time to connect. Okay. So when we say change from within, it is about our attitudes, thoughts, and emotions. So if some of us are saying, I'm not confident, okay, and the thought pattern is that, which means you're anxious in front of a patient. Now work on that, which means fantastically go and ask whoever you need to go to get that right. A simple example, when I was driving, I refused to go and get my license until I did parallel parking. It took me 4 months. But I told myself, I will not get a license till I learn that. Simple motivation, but it works. Today, if anybody honks, if my car stops, I will not get flustered. Simple. A simple way of earning a competency. Okay. And in behavior, we bring it out. Having all this here is fine, but you have to bring it out in our actions and behaviors. Okay? So, these are a couple of things that we are doing, which is active listening, showing respect for the client, which means as soon as they come in, we may be busily entering the earlier record, or we might be answering a family thing, whatever it is. Look up, look at them, and say, just 1 second, I'm finishing this. They will respect that. Walking past somebody and not looking at them. These are things that we don't show respect enough. Seek permission. If you're doing a test and you're saying, right now, I'm going to ask you to shift to this, and I'm going to take, your lens thing, or I'm going to do this particular process for you. After this, you're going to do this. So seek permission, can I start this? Use confirming positive comments to say that, appreciate a question if they're asking. Don't judge the question. Come from where they are, not from where we are. Okay? And then adapt your client's culture values. Today in the world, we are becoming global, which means our culture is quite similar. Okay? At the same time, we are very diverse. So you have a 7-year-old you have to relate to, you have a 80+ person you have to relate to, you have a global person in front of you. So don't second guess their culture, look for cues from them, ask a question and patiently listen. They will tell you the answer whether it's comfortable or not. You don't have to guess it for them. Okay. The ones on the right are all the non-verbals. Assess your patient's state of mind to receive what you say. Okay. So shall we do one more experiment? Okay, this time stand up. Okay, this time just listen to me before you start, okay? So stand up and pair with one person next to you. Pair with one person next to you. Or you can sit down, or standing is better. Okay, so decide who's going to speak and who's going to listen among you all. Who's going to speak and who's going to listen among you all? Okay, among your pairs, who's going to speak? Put your hand up. In a pair, who's going to be speaking? Okay? Right. So the exercise is, okay, until I tell you the instruction, your eyes are on me, okay? And the funny thing about our eyes is where the eyes go, the mind goes. So please look at me, okay? All right, so here's what you want to do. The person speaking, okay, talk about a particular challenge in healthcare that you've observed somebody, whatever it is, or a particular challenge that you've succeeded in your life, okay? And here, the exercise is for the listeners. Your job is to just listen, connect to them, and make them feel that they have been heard. Deal? Heard. Thank you. Heard. Okay, are you okay for the exercise? All right, start. You can sit if you want. We are on time. And thank your partner and bring your attention back here. Thank your partner. Thank your partner and bring your attention back here. No, it's okay, it's right. Awesome. Your rate of coming back to silence is faster. Thank you. Okay, so 2 seconds to bring your attention completely here. See, this is everything I do is unfortunately designed, okay? In the sense that when I challenge you to turn and give your attention, I'm challenging you that the mind can become fully present in 2 seconds. We don't think it's possible, but it's actually possible. So are you in the present is a very, very powerful quality, because without that, anything you do, you're absent to the person. How many times you have spoken to either your mom or somebody else and, you've spoken, but you felt they have not listened to you. Have you experienced that? Okay. Did it happen today in your pair? I hope not. Okay, how many of you have listened effectively? Let me ask that question. All the listeners. How many of you listened effectively? Self-assessment. Okay, fine. How many of you all were definitely maintaining a connection or eye contact with them? Without staring. Please don't stare, it makes it uncomfortable. All right. Okay. So in a nutshell, 2 seconds. In a nutshell, what you did is look at creating a rapport, listening to them in a way that they feel like speaking. Okay. I've always learned, and this my mother taught me, which is listening is a gift. Okay. In patient care, it is an advantage as well. Appropriate posture, appropriate distance. Okay. So last few things before I conclude is, in general, these are a couple of other things I want you to do, okay? I had a dentist friend, and she was doing the dentist thing, so she never actually sat under as a patient, having her teeth, any procedure on her teeth, okay? So she used to tell the person, when she used to put the injection for numbing the jaw, how many of you have been to a dentist? Okay, quite a bit, okay. So when they put that injection, she used to say, it won't pain, okay? And then she had a pain and she had to go under another dentist's direction, and they put that injection and it really pained. And she told me this story. Why here? She told me this story saying, Uma, after that, I've changed the way I tell my patients. It'll pain, but only for 2 seconds. Why am I bringing it here? Is because avoid trivializing or exaggerating. Oh, this is nothing. Just go ahead and do it. No, it is a big thing for them. Or when there is a real news that you have to give them the data facts, give them time to digest. Okay? Be comfortable that some patients will listen that time, but go home and have all their doubts. Don't think, you could have asked me that time, no? You were in front of me. No, they need that time to process. Anyway, so be with the client when you're with the client and no one else. Not even in imagination, okay? Unless you have an emergency. I've seen some doctors say, this is a family emergency, I'm keeping my phone on. When it comes, I will take it. Okay? This is a respecting the patient, okay? So anyway, conclude amenably in the sense that they shouldn't necessarily go happy, but they should feel that, yep, this is the deal, I understood, and I can come back to this person. I can trust what this person has guided me for. So with that, I leave you with what we say is not always what others hear. Okay? Words have power, so in your life, be aware of the words you use. Okay? The attitude matters, your energy matters. The reason I asked you the greeting exercise was in 2 minutes, you moved from sleepy to positive. From 2 minutes, you moved from slightly okay energy to happy energy. So we can, the way we greet a person when they walk in, you can create the energy in your room. Okay. So be in the here and now. What you put your attention on expands. So if you're having confusion within you and clarity within you, pay attention to the clarity and ask yourself, what more do I need to get clarity? That will give you the clue. Trust me, we are amazing as human beings. So if you ask the right questions, the answer will come. And the last one is, it's always in the service of the patient. So it's something through you or through anybody that you know, but that person gets what they need to get. Okay? So with that, thank you very much. You can always reach out to me, and thank you very much.